Hi there, I am Michelle G. Rogers, and what I'm going to show you right now is how you can roll out your glute area, your hips, and basically all of the muscles that really are closely connected to your low back. So if you generally have some low back pain, or maybe you sit a lot during your day and a lot of people aren't really sure where the pain is coming from, it just feels like it's around here, you'll probably really benefit from learning how to do this. So I have my 3 torture tools right next to me here, and again, if you're just doing this for the first time, I recommend starting with the foam roll and then taking it maybe a little further with the smaller balls. But what you're going to do, and this is also a little difficult to get into and explain, so I want you to carefully watch me here. You're going to sit on your cheek, okay? You want to be somewhat sideways, so you're not fully facing the ceiling, you're sort of on a slight angle away from the ceiling, and then you're going to pull down to the floor so you're holding yourself up with your arm. What you do with that side leg, the side that's on the foam roll, this is very, very indicative. So how you move your leg is going to dictate how much pain or tenderness you're going to find with the foam roll. There are a lot of little muscles underneath the Gluteus Maximus and the glute medius, rotator muscles. They're very tiny. So when your knee is bent and your hip is bent, you're going to stretch out those muscles and make room to sort of get in closer to the joint. Okay, so as long as you're feeling a little bit like you're above the bone and in between things, you're going to hit some spots there. Pretty much everybody has some, area that they can connect with here. Right now, I'm aiming more for the piriformis. This is a very tiny muscle. It's an external rotator of the hip. The sciatic nerve literally winds through that piriformis muscle. So a lot of people who have, some low back pain or sciatic nerve pain that goes down their leg have a really tight piriformis, and this will help to relieve that. So just feel around. I like to sometimes bend and straighten my leg and rotate it a little bit and try to find the area that is really the most tender. And then that is going to be something that you want to stick around with and feel around. There's not a lot of space to go there, okay? So when, again, you get tired of using the foam roll and that's not really effective enough, this is when you get into using this either medicine ball or soccer ball or the lacrosse ball. And you'll, again, have to control that ball a little bit more than you would the foam roll, but it's going to be pretty much the same thing. You're going to start with your feet on the floor and feel around sort of on that cheeky area, the fleshy area. And if you find a spot, just stick with it. And if you're able to, you cross your leg over. Now, when you move into the ball, after you've graduated from the foam roll, you'll find it is a lot more painful. So just lifting your leg up might be just enough. So maybe you want to stick around here a little bit until you start to break up that tissue, and then you can move on. Okay, and that is going to be the first part of your hip that will help to release the glutes and the low back.